Heart disease is the #1 killer of women around the world, and the symptoms of a heart attack can present differently in women compared to men. That's why a number of women's heart health experts are putting on a special event to raise awareness, education, and training to prevent or reduce the severity of heart disease. It's called the Mega Heart Event, and it's happening Sunday at the Wellness Institute on Leela. Joining us now are women's heart health advocate Jackie Ratz and the director of the Institute of Cardiovascular Sciences, Dr. Lorrie Kirshenbaum. Good morning to both of you.
Good morning.
Let's start with your story. This started for you when you were 24 years old, your heart health journey. Tell us what happened.
So when I was 24, I was diagnosed with non-Hodgkin's lymphoma. So I had a tumor, I had cancer that was putting pressure on my heart. So I had a lemon and an orange that were putting pressure. And so I went through full rounds of chemo and radiation, and they told me I got a clean bill of health 10 years later. Well, keep going, 10 years after that. So 20 years after that initial life-saving therapy that I had, the chemo and the radiation, I developed chemo-induced cardiomyopathy. Sorry, some of these words are a little hard for me to say sometimes, especially first thing in the morning. And so at age 44, I developed heart disease. And then fast forward beyond that, at 47, I developed heart failure. So for me, it's been quite a journey with my health, because I had no idea that I was going to be facing lifelong chronic illness in my mid-40s. The heart failure came as a complete surprise, because I thought I was doing well, but my heart function dropped low enough that they needed to put in a CRT-D device for me. So I now have my own defibrillator and my own synchronization, so my heart can beat actually on an even keel.
And Doctor, heart health for women, there's so many unknowns. There's not enough research. The St. Boniface Hospital has sort of taken the step ahead to try to do research into this. Tell us a little bit about why there's such a need for, especially women's heart health.
Right, thank you. First off, thank you very much for having us here.
Yeah, of course.
You know, allowing us to advocate and promote women heart health. So correct, St. Boniface Hospital has taken the lead role in developing a dedicated women's heart health program for the province, and for us to better understand the roles of heart disease and better treatment of women. The reason largely surrounds the fact that historically a lot of heart research had been conducted in males, and a lot of the trials were extrapolated to women. But the bottom line is that women are understudied, underrepresented, and unaware in some cases of the signs and symptoms of heart disease. And our goal is to bring greater awareness in research that will lead to new discoveries and better patient care and delivery.
There are things that women can do proactively to sort of avoid heart disease. And so this heart event that is happening on Sunday is helping women get those tools and that information?
Absolutely. So the event that we are excited to be a part of, I mean, it's a number of sponsors that have come together to make this happen, is about bringing awareness for women and their families, and also about making sure that women have access to information. So it's sort of a twofold. So we have a great event planned. We have guest speakers that are going to be speaking. We are even educating the little ones with a session on heart health and what the heart does. And then we also have an Ask the Expert session, which Lorrie will be moderating. I will be sitting at, and we'll have a number of other experts. There is a track, so we encourage everyone to come in and do a 2-kilometer or 5-kilometer walk. We also have an information area, trivia. We have a raffle that's going on with a bingo card. So if you get all the different spots, you get raffle tickets for a $500 raffle prize that the sponsors have put together for this event. There's a kids corner. We have Zumba. I hope the heart will be there. It's got so much going on. It's amazing.
And it's really for the entire family.
It really is. It's about making sure that not only women have the information that they need, but it's also about their husbands as well as their children to be aware that there are things that they can be doing as a family unit to protect mom's heart.
And are there things that women can do every single day that can protect their hearts? Because you found out later in life that this was happening, and unfortunately it was too late. Are there things we can do to prevent that it's too late for me kind of thing?
Absolutely. We need to talk more about our heart health with our doctors as well early on. So there is a free checklist that I have created in conjunction with St. Boniface Hospital over at lifeandhearts.ca, and it's about how is my heart. So get your heart checked. Go through the risk factors. The more risk factors you have, the greater opportunity for the heart disease to develop in you. So things like smoking, stress, genetics do play a part, but 80% of heart disease can be prevented if you know what you're doing.
And what is the number one tip women can do to prevent heart disease?
Well, part of this, as Jackie mentioned, it's awareness. Women present differently than men sometimes with respect to heart disease, so their symptomology may not be the classic jaw pain or radiating pain or crushing chest pain. It could be vague symptoms. They may just feel tired, and often they would just dismiss this as, I'm just not well today, or I'm feeling off. That's the key, and by understanding that these symptoms are real and they may be, maybe something that should be treated or examined by a physician. I would recommend 911, going to the emergency room if you're feeling this unwell. So it's the education, and that's what women have to be aware of.
Okay, and again, the Mega Heart event is happening on Sunday on Leela at the Wellness Institute there. So if you want